Now, tying into this is care plans and health assessments. These are things that you will see done that aim to take that holistic approach to look after the patient. The GP management plan is the main one most people talk about, or chronic disease management plan. This is when you've been in the hospital setting, that 5 free physio visits that you've probably spoken about, and unfortunately, they're not free, they're subsidised, which causes all kinds of grief for a lot of patients, but also you actually require very strict conditions to be eligible for these things. So again, I strongly encourage you all to read up the Medicare item numbers when you get into practice. 721, 723, the big ones you'll worry about there. But I wanted to focus on the fact that these then become kind of just billing items to try and maximise revenue, because they are big income earners for GPs doing these. And sadly, they can be a bit of a churn and burn to just try and get through as many of these as possible, just to try and keep things afloat. But they're actually fantastic opportunities to make sure you are developing comprehensive care for your patients. And they're also times, particularly in your early training, where you can guarantee you're getting massive chunks of time with patients to be running through each of their issues and making sure we are addressing them with a plan in place to continue to address those over the next 12 months. Now, tied into those is team care arrangements, where we tie in allied health professionals, and this is that subsidised visits to physiotherapy or podiatry or other health professionals. And I'm a massive, massive fan of just calling them directly on the day and saying, hey, I'm sitting here with patient X or patient Y, and we're trying to get a team care arrangement set up. Would you be happy to do this? These are the things we're trying to focus on. Are you happy if I send you through the paperwork and we get this moving ahead? I think the allied health professionals often really appreciate that kind of direct communication of, hey, this is what we're trying to achieve, this is why we're doing it in this way for this patient, and certainly closes that feedback loop for them. Now, part of this is to also regularly review and update the care plans. 1, there's financial reimbursement for doing this, and 2, make sure we're actually hitting the goals we're trying to set. As part of goal setting, we should be saying we're hoping to achieve this target by this time frame, and we have to hold the patient and ourselves and the other team members accountable for that as well. So good opportunities to actually intervene, step in and say, is this working, or do we actually need to adjust what we're doing? Of course, document care plan outcomes, communicate through to the patient, and if it's not written down, it didn't happen, which sadly, going back to the last slide, would get you in an audit.